Good evening. Oh,
I can start.
It is rightly said, safety isn't expensive, it is priceless. Every single person in the world has the capacity to save a life. It is an essential gesture of solidarity. First aid education should be accessible to all. Be a hero and save lives. Respected Principal Ma'am Miss Asna Nafis, Vice Principal Senior Secondary School Miss Soma Bhattacharjee, Vice Principal Secondary School Miss Mary Cruz, Vice Principal Junior School Miss Shipra Parvez Sheikh, Headmistress Junior School Miss Sini Menon, esteemed guest of today's evening, parents, teachers, my fellow directors of Science Club, and my dear friends. A very good evening to all. On behalf of the Science Club of DPS-Modern Indian School, I, Humaira, welcome you all for today's webinar on first aid awareness. Now I hand over the proceedings to my co-director, Naveen.
Just imagine you're walking on a street and find somebody badly injured. There is no one around. What would you do in this situation? Would you call someone for help and wait for the person to arrive? Or would you tend to the person yourself if you have the first aid awareness? In fact, an ambulance on an average takes 8 minutes to arrive, but one can die from a blocked airway within 4 minutes. And an immediate first aid can make a real difference. Keeping this in mind, today we have amidst us Dr. Romina Nizamuddin, a doctor from Nasim Al Rabi Medical Center. She holds an MBBS degree and practices general medicine. She will provide us with a brief insight into some life-saving techniques to help us become more responsible and sensitive global citizens. On behalf of DPS Modern Indian School, I, Naveen, welcome you, ma'am. Dear attendees, all your queries will be answered by the end of this webinar, so sit tight and enjoy the show. Now I invite Dr. Romina to take the stage.
okay. Hello, everybody. Thank you, first of all, for giving me the opportunity. Delhi Public School, the staff, principal, vice principal, and all the other relevant staff who is responsible for arranging this meeting, which is going to be, inshallah, hopefully valuable and also more informative for you. Okay, so first of all, starting with what is first aid? First aid means taking an immediate action to help someone who has been injured or is involved in an accident or is in a medical emergency. Whether if it is a baby, a child, or an adult in need of care, the purpose of first aid is to keep someone alive and to protect the person from further injuries. So now I will be speaking about various scenarios in which we different scenarios in which we can provide different kinds of first aid to help the person to keep them alive or to keep them from further injury, as I have mentioned. So first, coming on to, I will explain regarding head injuries. Head injuries, any of us, suppose if it is again, I'm speaking generally regarding a child, a teenager, or an adult, whoever it may be. If the person encounters a head injury following a fall, an accident, or any other way in which the head is injured, which means there are cuts or bruises or contusions or concussions to the head, anything which involves the head, the first thing that you can do is observe the person. If the person is alert, if the person is feeling dizzy, if the person is having any seizures, if the person has any vomiting, these are all, or any confusion, or if the person is feeling sleepy or drowsy. These are the things that you have to first of all check if a person comes to you with, I mean, sorry, it doesn't come to you. I was just talking about the general things in the OPD. If a person presents with a head injury. So first, what you can do, being the bystander or the person who has witnessed the head injury, what you can do is First check the neck, if anything has affected the neck, if there are any fractures, if the person is able to move the neck or not, because such kind of injuries can happen during sports. This is called sport injury. If the person can move the neck, then well and good enough, the person is mobile. But if the person cannot move his or her neck, then you should not try to move it. Instead, lie down the person on the floor or wherever the person has been injured. See to it that the person is stable. Don't try to move the person if the neck has been injured or if the person cannot move the neck, and call for help immediately, which means dialing an ambulance or approaching a medical professional, whoever is first approachable. So that's about the head injury. Next thing I will be talking about is regarding severe allergic reactions. Severe allergic reactions can occur due to many causes. It could be some kind of food allergy, some kind of drug allergy, or some kind of pollen allergy, as bronchial asthma. It can all present as severe allergic reactions. So what are the things that, or what are the symptoms that the person will present with in case of a severe allergic reaction is, number one, the person can have breathlessness or difficulty in breathing in case of asthma, or maybe any kinds of allergic reaction which involves the respiratory system. The patient will present with breathlessness or difficulty to breathe. So that is number one of the symptoms. Number two, hives. The face and the entire body, the neck, the hands, the limbs, everything can be involved. Hives means, as we all know, it's just an inflammatory reaction to any foreign body that has entered the body, or it could be because, again, as I mentioned, all the factors, how a person can receive or get a severe allergic reaction. So, and then the person can also feel dizzy, have any vomiting, or fever. Even fevers can happen in severe allergic reactions, but that's a little bit later on the person. In the immediate spot, it's these. If difficulty in breathing, the person can have hives all over the body, a dizziness feeling, and the loss of vision as well can happen sometimes in severe allergic cases. So what we can do if you witness a severe allergic patient, or if a person, suppose it is an asthmatic patient, and if he or she is having acute bronchial asthma, it is an exacerbation that's going on, and the person is holding the neck and like the person can't breathe. It's difficulty. That's the usual symptom that we see when the patient has difficulty in breathing. So what do? The first thing is you have to ask the patient if he or she can hear you, and then if he or she has the inhalers with them, which they are taking regularly. If the person has the inhaler, allow the person, if suppose the person is standing upright, allow the person to bend a little forward and use the inhaler, 1 or 2 puffs according to the dosage that's being taken. Allow the person to take the inhaler and breathe normally. If the attack lasts for more than 5 minutes, call for an ambulance immediately. So that's what you do in case of bronchial asthma. Ask the person to lean forward. Ask if the person has the concerned inhaler or the medication which they take in time of an acute attack. Take it immediately and call for an ambulance. Then the next thing, if it is a food allergy, if the person has developed hives all over the body as a matter of inflammatory reaction, what you can do is, if you have a trained nurse around you in such kind of circumstances, and if epinephrine injection is available, basically in that kind of setup, if a trained nurse or a trained personnel is available for giving the injection, the epinephrine injection can be given immediately, and then call for help. If there is no trained professional with you, or you cannot reach the injection immediately, call for an ambulance immediately. So that's regarding severe allergic reactions. Now coming on to cuts and bruises. What is the first aid in cuts and bruises? So first we can differentiate between what is cuts and what is bruises, basically grazes. Grazes in the sense is when a person, if a child or an adult is playing, or if in case an adult is just walking through the road or doing some kind of activity and falls, and he or she just damages the superficial layers of the skin, which means just a scratch, that's called graze. But if there is a deep cut, as we all know, with like any sharp objects or anything else which makes a cut, which is going into the deeper layers of the skin, then it's called cuts. So that's how we differentiate between grazes and cuts. So the first aid for grazes is just normal things that we all do or we all can do easily, is wash the graze well with soap and water, apply an antiseptic solution, and cover the wound with a sterile gauze if possible, if reachable. In case of cuts, again, if it depends on how deep the cut is. If it is very deep and it requires medical attention and suturing, of course, as first control the bleeding, that is, apply direct pressure over the wound for 20 minutes, call for an ambulance immediately if the injury requires suturing. Call for medical professionals, call for the ambulance immediately. So that's what is the first aid that you can do for cuts and grazes. Next, coming on to in cases of children, it's a very common thing that we find is regarding the teeth, any chipped or knocked out teeth. Usually this happens when other children's head comes and hits on a child's teeth. There is chance that the teeth can break or it can get chipped off or even knocked out. The entire teeth can get knocked out. Such kind of injuries, as I mentioned, is usually when they hit the head or when they fall from a height or even in accidents. Anything can happen for which this has to happen. So what do you do when the child has a chipped or a knocked out teeth? Chipped teeth basically means a broken teeth. A broken teeth is not a medical emergency, but yes, of course, you have to do the dental consultation and do the necessary steps. If the teeth has to be removed, then it has to be removed. Otherwise, it can be preserved. If it is a knocked out tooth, in the sense if there is an exposed nerve is a medical emergency. You have to approach the hospital immediately or the dental doctor immediately. But meanwhile, if the teeth can be placed back into its socket, if the child is old enough for that, like you can help, of course, place back into the socket, and it has to be held with a piece of cloth or a tissue or anything if it can be held back. I'm talking about in case of a knocked out teeth, which has exposure of nerves, okay? So we help or aid the child to keep the teeth back into the socket, and with the help of a tissue or a cloth or a towel or anything which the child is comfortable with, and rush to the hospital immediately. That's what you have to do for a knocked out teeth. Then coming on to nosebleeds. This is also something which we frequently come across. It could be because of many causes. Nosebleeds can be due to medical reasons or even due to other physical trauma. Due to medical reasons, of course, there are many causes which we don't have to explain in this context, but yes, medical reasons do cause nosebleeds, and even traumatic conditions do cause nosebleeds. But what is the first aid, or what is the first step that you can do if you see a person having a nosebleed? First of all, there is a myth that if there is a nosebleed, you ask the person to lean back, basically lean back and pinch your nose. No, that is the biggest mistake that we can do. Never lean back in case of a nosebleed, because what happens is when you lean back, the blood from your nose can move down through your throat and cause choking. The blood can cause choking. And if not, the blood can go down the esophagus, reach the stomach, and even cause vomiting. Hematemesis, basically you can vomit out blood if you lean back. So never lean back. Never ask the person to lean back in case of a nosebleed. Always ask the person. What you have to do is the do's in nosebleeds, or in medical terms, it is called epistaxis. What you can do is ask the person to lean forward instead. Lean forward and pinch the end of the nostrils where the nasal bone ends. Pinch it firmly. Lean forward for 20 minutes. That's what you can do as the first aid of nasal bleeding. Never try to put stuff in tissues or anything of that sort. Ice packs can also be provided, but after 20 minutes. The first thing or the first step is to do lean forward, pinch the nostrils for 20 minutes. If the bleeding does not stop beyond 20 minutes, of course, call an ambulance or seek medical advice, because it could be due to a traumatic reason, or if there is any fracture of the nasal bones, if the person is in severe pain, immediate medical attention. So that's regarding first aid in nosebleeds or epistaxis. Next is coming on to broken bones. What you can do regarding the first aid of broken bones. Broken bones usually may present in two ways. One is there will be a defect in the appearance of the limb. Number two is that the bone can break, pinch through the flesh and come out. So basically a visible bone outside. These are the two ways which a broken bone will present with. And of course, the person will be in severe pain. So what you have to do is move the affected limb as little as possible. Never try to move the affected limb. Keep the patient stationary, lie down on the back if possible, whichever position the patient was in, let him or her be comfortable in that position and call an ambulance immediately. Don't try to do anything. Don't try to rotate or move or change the position of the person because it may lead to severe damages, which includes muscle damage, nerve damages, and even loss of the nerve supply to the affected limb, which could lead to amputation later on. So never change the position of a person who has a broken bone or a fracture. Lie down or keep the person in the most comfortable position and call an ambulance immediately. So that's what you do in broken bones. Next, coming on to eye injuries. Common eye injuries which can happen in children and adults. In children, it's more frequent because they can get foreign bodies into their eyes. It could be a chipped out toy piece, or it could be some kind of dust, pollen, anything that can be a foreign body and go into the eye of a child. And in case of adults, there would be many other reasons for foreign body. So the first thing, in case of a child, the children are more, they have more tendency to rub their eyes because of course there will be tearing and the foreign body sensation is not going to be really favorable for them. So what they do is they tend to keep rubbing their eyes. So the problem is when they rub their eyes more, what happens is it leads to corneal, there could be scratches in the cornea, basically. It leads to scratches in the cornea and it can even cause blindness. So never encourage your child to rub their eyes. Of course, it is a natural tendency for when a child has a foreign body sensation in the eye, they tend to rub it and they start crying saying that, oh, you know, I have something in my eye. But try, if it is too severe, of course, like place a sterile padding on the eye and rush to the hospital immediately. But if the child is able to cooperate with you, what you can do is you can open the eye, like keep it really wide and try to flush in some saline water if available, or else normal temperature tap water would do. Irrigation, basically, you're trying to wash off. If the child can lie like this kind of position and you can irrigate, pouring the water into the eye and the water goes away through the side, good enough. If the foreign body can be washed away, good enough. Otherwise, again, patch the eye with a sterile dressing and approach a medical healthcare professional immediately. Never encourage the child or the adults to rub the eye in case of any foreign bodies, because it will lead to more complications, including even blindness. All right, now coming to the most important section of first aid is we can divide it into choking, basically choking on any food stuff, anything you can choke on, choking, seizures. So I will be showing you certain maneuvers regarding how to save a person from further damage or from even losing his life. So there will be certain things that I will be showing you, certain maneuvers which you can follow regarding when a person is choking on something. So I'll just give me a minute. I will just arrange my dummy and I will get back. Yeah. Okay, I hope all of you can see this dummy. So I will be demonstrating certain things on this dummy. So suppose a person has choked on something while he or she is having food. So the first thing, it can happen to adults as well as children. The person can present with a difficulty in breathing. He or she will hold their neck like this and start to the first thing they do is in foreign body aspiration is they try to cough it out. They try to expel the foreign body by coughing it out. So if the person is coughing, allow the person to cough. Don't interrupt in between that. See if the person can cough out the foreign body. So just wait for a minute and see if the person can cough it out on his or her own. But if the person is changing color, if the person is turning blue and has difficulty in breathing and is not allowed, is not, cannot cough, then the first thing that you can do is, first maneuver is basically to come to the back of the person, allow the person to bend forward and use the heel of your palm, and these are the two shoulder blades. Use the heel of your palm and come in between the shoulder blades and give 4, 1, 2, 3, 4 forceful thrusts between the shoulder blades. Keep the person tilted like this and 4 forceful thuds. 3, 4, okay? And you see, and you check his airway. If he has expelled the foreign body, good enough. So he's on the safe side. If still he's having the problem, he's still choking, if he's still holding both his hands on his throat and he's like, sometimes they just become like that. They're not able to breathe properly. So what you can do is, the next thing is called Heimlich's maneuver. So first you have to go to the back of the person. Then you have to make a fist with your left hand. Aim for this is called the sternum, basically, the breastbone or the sternum. And this is the umbilicus or the navel of the person. So there is a point in between the sternum, the end of the sternum, and the umbilicus or the navel of a person. Go to the final 1/3 of the sternum, make a fist with your left hand, use your right hand like this to cover the fist, and go from the back of the person. And 1, 2, 3, 4. 4 forceful thrusts, okay? 4 forceful thrusts to the last 1/3 of the sternum, and again a little in the bent position. As I mentioned, fist with the left hand, cover hand with the right hand. 1, 2, 3, 4, and allow the person to cough it out. Mostly with this maneuver, the person is supposed to recover. Check his airway. If he has anything in the mouth, ask him if he can take it out himself before you start inserting yourself or your hand inside the mouth. Ask the person if he or she can take it out on his or her own. Okay, so that's regarding choking. So the first thing, ask if the person can cough it out. Second thing, give the back blows. If that's not working, Heimlich's maneuver. That is the last thing that you have to do. Then coming on to seizures. Okay, wait. Now, first thing I will do is I will just demonstrate the CPR procedure as well, which is CPR, as we all know, is called the CPR is called cardiopulmonary resuscitation. It is a process which you have to do, or a method which you have to do if a person is unresponsive. Only if the person is unresponsive. First thing, what you listen is unconscious. Listen first. Listen with your ears. Listen into his mouth. If you can feel or hear that breathing sounds, and if you can feel his or her breath on your cheeks. Then the second thing you have to do is check the pulse of the person. With your 2 fingers, you can place it on the wrist, or you can check the pulse on the neck. Check if there is no breathing and no pulse. That's when you have to initiate CPR or cardiopulmonary resuscitation. The first step that you have to do is, in the basic ratio of CPR is that 30:2. That's what we say in case of adults. In case of children below 10 years, it is 15:2. 30 blows like this and 2 respirations that you have to give in the mouth. It's called 2 rescue breathings. In case of children below 10 years, 1 to 10 thrusts with 2 rescue blows. So the method for CPR is, first you have to place a hand, your left hand again on the last, place your hand. Then with the other hand, with the right hand, you have to keep on top of the left. and keep your hands, basically the elbow has to be straight. The elbow has to be straight and the force has to come from your body, not from the wrist or from the elbow. It should be from the body, basically like up all the way from the body, like a hen pecking, that's what we say. So like this, right hand like this, and then keep the elbow straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, another set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, a set of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then the first thing you have to do is tilt the person's head backwards, open the mouth, and give 2 rescue blows. 2 blows into the mouth of the person. Okay, so then you have to check the response, check if the person is breathing, check the pulse. Meanwhile, always call for help. The first thing you have to do is, if there is a person near you, call for help immediately. If the person is still not responding, the medical personnel, whoever is there to assist, will help you. So I hope all of you are clear with the CPR. Okay. In case of just coming on to children from 1 to 2, we don't use the entire palm like this, of course, because their rib cage is much smaller. In case of below 1 year, what you have to do is you have to use 2 fingers at the tip of the sternum. Again, that last 1/3 of this breastbone, you keep 2 fingers and you have to give 15 thrusts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 15 thrusts, followed by, again, tilt the head back and then open the mouth and 2 respiratory blows. Okay, never keep the patient's head straight and blow. It's the most common mistake that we see. Never do that. Always keep the head like this. The neck has to be tilted to the back so that the head is like this, so the airway is completely open. And then open the mouth and give the 2 respiratory blows. So in children, 15:2. In adults, it is 30:2. That is the ratio for CPR. Okay. Okay, and now the first aid for seizures. Seizures is also a most common condition that we see in both children and in adults. It's a very life-threatening thing according to laymen, but it's nothing much to worry about. As you know, seizures happen due to many causes. Seizures can happen in children even because of a fever, or in adults because of certain other chronic seizures like brain tumors or any other causes, medical seizures. So the first aid that you can do when a person is experiencing a seizure is, there are many myths that some people especially back in India, we do say that give keys in their hands or try to put some kind of gauge in their mouth, so they stop themselves, or they prevent their tongue. But never insert anything into the mouth of a person having seizure, because we may think that, oh, let him or her not try to injure his or her own tongue, or you try to even keep the mouth open with your own hands. No, it's the most biggest mistake that you can do. Never insert anything into the mouth of a person who is having a seizure, or never try to give any. The first thing that you have to do if you see a person who is having a seizure is never lie the person on the back. Always keep the person on the lateral position, on the sideways position. Keep the head flexed back if possible, and just hold the person like this till his seizure is over. He may have froth coming from his mouth, he may wet himself, he may soil himself, but just wait. And if possible, always note the time, how much, at what time the seizure has begun and what time the seizure has ended. So always place the person on the lateral position, flex the head to the back so that the airway is more open and he does not aspirate on his own secretions or the froth that is coming during the seizures, and wait for the seizure to pass. Usually a seizure lasts for less than 5 minutes. It doesn't last for more than 5 minutes. And even during the seizure time, a person can turn blue. That's normal. It's perfectly normal if the person is blue during the seizure. But if a person is still blue and is still having difficulty in breathing after the seizure attack, call an ambulance immediately. Otherwise, just wait for the seizure to finish and just note the time. Again, as I mentioned, if it exceeds 5 minutes, call an ambulance immediately. Okay, so that's about the dummy. Then we'll come across people having heart attacks in front of us. These days, even there is no age. Even children above 18 years old do get heart attacks. So the first thing that we have to do in heart attack is, of course, we can't do much about it. But if the person is not having a pulse or not breathing or is unconscious, do the CPR or the cardiopulmonary resuscitation until help arrives. Call an ambulance first, then do the CPR. Never wait for the CPR to finish to call the ambulance. If you have someone around, always make them call the ambulance, or you yourself call the ambulance, put it on loudspeaker, and then start the CPR. Before you approach a person who is in danger, suppose the person, as I mentioned now, is unconscious, had a heart attack, fell unconscious suddenly, has a fainting episode, anything, always check for your own safety first. Check if the person who is sick or who's ill or who's having the injury is in a safe zone. Basically, if they have any water around, you should be careful that you don't slip. If they have any electrical wires, always be careful. So your safety as well do come first. Of course, you don't want to rush into an accident scene or into a place where there is a person who is sick and you yourself don't want to fall into that. So because these do happen in cases of drowning and everything, if a person doesn't know how to swim and they are drowning and their loved ones are watching them and they themselves don't know swimming, even they tend to jump into the water. But never do that. Always call for help. Always call for a person who knows better than you. Okay, if in case of drowning cases. Otherwise, before you approach a patient who is a person who is unconscious or anything, always look around. Look around for danger first before you approach the person. Yes, so that's it pretty much. I hope it was an informative session. I hope I have covered all the points. If you have anything, any doubts, questionnaire is open. All questions are welcome. Can you hear me?
Yes, ma'am, you're audible.
Yeah.
That was indeed an amazing talk. So audience members, if you have any questions, please put it down in the Facebook comments and I will be asking those questions to Dr. Romina. Thank you.
Doctor, there's a query.
Yes.
Yeah, if there is any burn injury from chemicals that the children are using in the chemistry lab, what is the
Yes.
first aid that could be provided immediately?
Okay, the first aid in case of chemical burns is first is wash the chemical burn with running tap water, normal temperature. We think that usually, of course, we all know that that's the first aid, but we just do it for 2 minutes and we take our hands or whichever part of our body has burned, but never take it away immediately. The minimum time that you have to keep it under running water is for 20 minutes. Because even if the surface of the skin is still cold or even cold because of the temperature of the water, but the deep layers of the skin may be getting burned. So in order to prevent that, always do a 20-minute wash under the running tap water and seek medical advice.
Okay, thank you.
You're welcome.
Ma'am, we have got a question. In
Yes.
case of a person having a seizure, what help can be provided for immediate relief?
Okay. As I mentioned in seizures, when a person is having a seizure, never try to interrupt the seizure because it cannot go away until the whole episode is over. So as I mentioned, always tilt the person to the side and keep the neck flexed to the back if possible, so that he or she does not aspirate on his or her own froth or secretions coming out of the mouth. Keep the person in the lateral position and keep the neck flexed and wait for the seizure to subside. Note the time. Usually a seizure lasts for 5 minutes. If it lasts for more than 5 minutes, seek medical help immediately.
Yes, ma'am.
Yes, ma'am. So what are some of the most common cases where first aid can be helpful for someone? Like what are the most common encounters for first aid?
Okay. Most common encounters, of course, we do have the first question, as I think one of your teachers asked me, is chemical burns. Then choking. Choking is a very common thing. We do think that many people don't choke, but of course, especially these days with the new habit is everybody keeps talking when they eat. So there is more chances for choking. So we do see a lot of choking. We see a lot of injuries, head injuries, even cuts, bruises, grazings, fractures. All these are common scenarios where we can provide first aid.
Thank you, ma'am.
Yeah.
Ma'am?
Yeah.
What can we do if we see someone swimming get a leg cramp? What can we do to help them?
A leg cramps. Okay. The first thing that you can do in a leg cramp is basically the person who gets the cramp will have a tendency to flex the leg. Basically, if the leg is like this, we all have a tendency to make it inside for getting more relief. But that's not the right thing you have to do. You have to, like, suppose this is the feet. The feet is always like this, right? Flex, make the feet come back towards your body. So the calf muscles get a stretch, and that's the best thing that you can do as a first aid for leg cramp. Like flex the feet towards the body, towards one's own body. Yes, that's the best thing you can do.
Thank you, ma'am.
Yeah.
Ma'am, one more query.
Yeah,
Suppose a child is wearing glasses
Mm-hmm.
and the child falls down while playing or something, and the glasses and the pieces of glasses enter the child's eyes. Then what is the
Mm-hmm.
first aid that could be given?
Rush to the hospital immediately. We don't have to even try to attempt to take it out, because what happens is the first thing that we do is we, of course, it's an emergency. So our hands may be not sanitized. It will be having germs on it, microorganisms on it. So if we even attempt to take our hand towards the eye, what we are doing is we are giving it a superimposed infection. So never try to take out anything from the eye. Foreign body, especially glass pieces, has to be rushed to the hospital immediately. Any other queries?
Yes, there are plenty coming up. Just hold on.
Yeah, sure, no issues.
Yeah, Sanish, go ahead.
Ma'am, one of the queries is whether CPR is only useful when in case of not being able to hear the breath or pulse, or in some other emergency too.
Okay, that's a good question. Usually CPR is only administered if the person is not breathing or if the person does not have pulse. Never attempt CPR on a person who has a pulse and is already breathing. Never attempt. It's the wrong thing to do.
How to help with burns caused in the kitchen or by heat?
By heat, okay. So I think one of the staff did ask about it, one of your teachers did ask about, that was chemical burns, she asked. The heat burns, the first aid that you can do is, of course, run to running tap water, keep the injured area under the running tap water for at least 20 minutes. We all do it, but we do it only for less than 2 minutes. And then we're like, oh, it's okay. And then we go straight to the freezer to get the ice and keep. But no, if it is a little bit of a severe burn, of course, we can see it. If a bleb is formed, basically like a bubble or a blob that is formed inside this on top of the skin, we do know that this burn is a little more severe. But otherwise, burns just have some kind of reddish, grazy kind of feeling on the skin. So that is a first degree burn. If it is a second degree burn, it do have blebs on the skin. So that has to be treated a little more carefully. The other ones can be kept under running tap water with normal temperature for at least 20 minutes, because even if the surface of the skin appears to be cold, there is a chance that the heat is still being transmitted to the deeper layers of the skin. So in order to prevent the deeper layers of the skin from being damaged, we have to follow this protocol of keeping under running water for 20 minutes at least.
Ma'am, what to do when a person has burning feeling inside their body in the chest?
Inside the chest, okay. Burning feeling, you mean like in this part of the chest, yeah? Okay. The burning feeling depends on how long before have you started having the feeling, like has it been on and off? Do you have any other discomfort like chest discomfort, which means like a heavy weight on your chest, or if you are experiencing any dizziness, any chest discomfort that is radiating to your arms. So it differs basically. A burning sensation alone maybe could be just plain gastritis or an acute gastritis that is caused due to some kind of lifestyle changes that has happened, maybe some kind of food that the person has taken, maybe excessive smoking, excessive caffeine intake. So it has to be evaluated. If only burning sensation is there, it's nothing much to be worried about. But if it is accompanied by any chest discomfort, as I have mentioned, of course, you have to go to a medical professional.
And what to do in case of a burn of skin?
I think I have already answered the question, yeah?
Yes, ma'am, it's another form of the question, that's all. Ma'am, how
Okay.
to avoid injuries, especially spot injuries?
Yeah. I think I did mention about sport injuries before. Sport injuries include like when the children are playing, if it is a football, basketball, any kinds of sport. So if there is a head injury, you can follow the protocols I had mentioned earlier. If there is any injury that is affecting the spine of the person, which means the person may not be able to move the neck or the body, of course, keep the person mobile, keep the person on the floor, and do not try to move the person, and call an ambulance immediately. That's what you have to do for sport injuries. Otherwise, as I mentioned, I think I mentioned about the head injuries regarding cuts and grazes, everything do come under sport injury, of course.
What are the most common misconceptions of first aid?
Yes, there are so many misconceptions that do happen in first aid, as I think a few of them I did mention. The first thing is regarding the epistaxis or the nosebleed, where everybody asks you to look to the back or lean to the back. That's the biggest mistake that one can do. Never lean to the back. It can cause even choking and even death, because they will choke on their own blood. So never ask the person to lean to the back. Always ask the person to lean forward and pinch the nose, I had mentioned earlier. Then also attempting CPR on a person who is already having a pulse or maybe taking intermittent breaths. Never attempt a CPR on a person who is already having a pulse or breathing. Just assist or try to, call for help. Yeah, these are some of the misconceptions that do happen during first aid. Then also some people, when they have these cuts, like deep cuts, maybe superficial cuts or deep cuts, they do apply tourniquets. They just tie the just above the cuts or the not graze. They do apply these tourniquets just above the cuts, and they think that doing so will stop the bleeding. But of course, that's a very big misconception that they can do. Never do that. Never apply tourniquets, because even the blood supply to the affected limb can be cut off, and even the limb may have to be amputated if the tourniquet is applied for a long duration of time. Then maybe I've even seen cases where people do apply heat instead of ice packs in case of, like, suppose ankle sprains, sport injuries and everything. Some people do apply heat, but that's as well a very wrong thing to do. Never apply heat, always apply ice to them, because heat, what happens is when you apply heat, the circulation increases, and in turn the swelling and the edema will increase. If you apply heat, always apply ice, because it allows to reduce the swelling. Yes, these are some of the common misconceptions of first aid.
Thank you, ma'am.
Yeah, sure.
Ma'am, we can go for another few questions, maybe another 3 questions.
Sure.
And
Yes,
then
ma'am.
stop. Okay.
Ma'am, if you have bleeding in head and the person is unconscious, what to do?
Okay, bleeding in the head, you mean like you can see the bleeding outside?
Yes, ma'am, I think so. Yeah.
Okay. So if the head is bleeding, of course, if the person is unconscious, call for help immediately. There is nothing else that you can do because, I mean, depends, of course, if the person is having a pulse, if the person is breathing, if the person is having a seizure, and such kind of things has to be monitored and call for help immediately.
What do we do in case of muscle pain?
Muscle pains. Okay, muscle pains are basically myalgia. It can happen in any part of the body. It usually happens due to overuse of the muscles or fatigue, or it even happens due to spondylosis. There are so many causes for muscle pains. So it depends on what is the cause for causing the muscle pain. Accordingly, there's no first aid for muscle pains actually. It's just depends on the cause. Yeah.
We have a question from our viewers.
Yeah.
What are the most essential contents in a first aid kit, and how often should one recheck their first aid kit?
Sure. A first aid kit, first of all, must contain everything should be sterile in it. They should have sterile gauzes, sterile bandages, an antiseptic solution, of course, gloves if possible. These are the few things that has to be kept in the first aid kit. And of course, if if the first aid kit has been used recently, everything has to be refilled. It depends on the frequency of how far you use it, and if there are any products which has an expiry date, of course you have to keep it in mind and keep refilling them.
Thank you, ma'am.
Yeah.
I think that's it, the questions from the audience.
All right.
Right.
Ma'am, now we'll go with the vote of thanks.
Sure.
A very good evening to one and all present here. It is my privilege to have been asked to propose a vote of thanks on this enriching occasion. I, Satyam Agarwal, on behalf of the entire Science Club, would like to extend a heartfelt thanks to our guest of the day, the speaker, Dr. Romina Nizamuddin, who took out valuable time from her extremely busy schedule to enlighten us on the importance of first aid. I'm sure all of us gained a lot of knowledge and insight into first aid today. My sincere gratitude to our esteemed management members who gave us this online platform to widen our horizons, to spread knowledge and information. My unending gratefulness to our beloved principal ma'am, Miss Asna Nafiz. Ma'am, you are the pillar of support to all of us. All this would not have taken shape without your valuable guidance and constant encouragement. Thank you so much, ma'am.
I, Shivani, as the Director of Science Club, offer my sincere appreciation towards the Vice Principals, Ms. Soma Bhattacharjee, Ms. Mary Cruz, Ms. Shifa Sheikh, and Headmistress Junior School, Ms. Sini Menon, for their guiding presence. For all the invisible hands behind today's program, I take this opportunity to wholeheartedly thank our First Aid Department, Computer Department, and IT Department.
I, Sanish, would now like to thank our teacher in charge, Ms. Sangamitra Roy, without whose tireless efforts this webinar would not have been possible. I would also like to extend my thanks to my fellow directors who helped organize today's event. And last, but absolutely not the least, I would like to thank our wonderful audience for being so patient and attentive throughout. Thank you, one and all. Have a pleasant evening ahead.
Thank you, Doctor, for taking time out. Thank you so much. I think being a young doctor helps a lot in reaching out to young crowds. So it did make a difference. And thank you to the entire Science Club for taking up this initiative. Ms. Soma, Ms. Sangamitra, and all the members. Excellent job. Thank you so much.